Bismillahirrahmanirrahim. Assalamu alaikum, dear audience. Today, our topic of discussion is about the use of glue in the management of corneal perforation. Well, when we talk about corneal perforation, it is a full thickness defect in the cornea which leads to the drainage of aqueous humor from the human eye outside. This perforation may be because of infection, trauma, degenerative diseases. All these things can cause corneal perforations. And these corneal perforations have to be closed as soon as possible. The reason is that the eye is exposed to atmosphere, external atmosphere, and now it is prone to infection. Number one, anytime the microorganisms which are already present in the conjunctival sac, in our eyelashes, eyelids, they can gain access and cause infection inside the eye. Secondly, when the pressure of the eye is decreased because of perforation, the normal structures of the eyeball, which are maintained in their place due to that pressure of the eye, are also under stress. Because now there is no pressure over there, perforation, fluid is coming out of the eye. So this can lead easily to not only to the infection, but also to choroidal detachment. So these are a few points in the corneal perforations. Many times we see patients with rheumatoid arthritis who have developed these things. And the first and foremost thing is to close it. There are many ways to close corneal perforations, but when we talk about small perforations like 2 to 3 millimeter, the most favorable way to close it is to use the glue. Yes, I'm talking about cyanoacrylate glue. Cyanoacrylate glue is a synthetic glue which closes it, and it is basically liquid. But as it comes with the liquid over there, with the water over there in the eye, it starts turning into solid. It maintains a barrier over there, and immediately it seals over there the perforation. The other thing is, once the cyanoacrylate glue has been applied, it has to be covered with a bandage contact lens. Cyanoacrylate glue not only closes the perforation, but it also has got to some extent bacteriostatic properties. It also inhibits the activity of collagenase in the cornea. So to some extent it also discourages, inhibits the melting. So these are the secondary advantages of this glue. But primarily we use it to close the perforation. And once it is applied, in just minutes, we can see that the anterior chamber starts forming over there. But very important, as I mentioned earlier, is to apply a bandage contact lens, because the patient feels irritation over there, the foreign body. It is foreign material over there. It is not biodegradable. It has ultimately has to be removed. It sloughs off after some time. So very important to be covered with bandage contact lens. Another cases where we have seen that in one slide where there's a red circle because of scarring over there, and there is central corneal thinning. Eye is trying to heal by its natural mechanism we can see the blood vessels encroaching over there in that area, but still we can see the central localized area, which is very thin. And these things can lead to perforations. The other photograph is about corneal infection. Here we can see corneal abscess is formed, and inferiorly the physician has applied glue to seal it off the area over there. And this is an infective cause. Because of excessive infection, the cornea has undergone melting, and in that specific place the physician most likely has applied to close it. This is also a way that the physician gets some time over there as a temporary maneuver before he goes for tectonic grafts. If the infection is very severe, it is not getting under control, and there is a micro leakage over there, so these type of glues can be applied over there to close that area. Very important to apply bandage contact lens. But the problem comes here when we put the bandage contact lens over there. The eye drops, for example, we are using quinolone eye drops, moxifloxacin, or fortified eye drops half hourly. We are putting it, but the bandage contact lens decreases the penetration of the medicine inside the eye. So at the same time, we have to keep an eye on that aspect also, that whether the infection is getting controlled or it is aggravating. If the infection is aggravating over there, it means that our medicines are not that much effective, or they are not getting penetration to the cornea. So we have to remove the bandage contact lens. Other photographs of the same patient where we have done the corneal transplant, and patient developed central localized corneal perforation. Whenever there is perforation, aqueous humor is coming outside the eye and anterior chamber gets flat. Here the photographer has tried to show the anterior chamber angle. In this photograph, we have shown choroidal detachment, one of the possible complications after corneal perforation. It may happen. Here we can see so extensive that the choroids, we call it typical sign, kissing choroids. From different sides, they are approaching. So why this happened? Because fluid is coming from outside, from the eye, and there is no pressure in the eye, and the normal pressure which maintains all structures at their place has been compromised. So this is a possible complications which can be encountered in the management of the corneal perforations. Now this is the patient with the corneal transplant plus perforation. Area was properly cleaned, all debris removed, minimal amount of cyanoacrylate glue was applied, and the area was again covered with bandage contact lens. The question arises, how long it will take to heal? Well, we follow up these patients regularly. And a very important sign of wound healing is the encroachment and development of blood vessels in those areas. Once blood vessels come over there, it means the wound is healing, the perforation is healing. And in corneal perforation, the small one, usually we can take 8 weeks plus, they start healing. And once we remove the bandage contact lens and we examine over there, we can see that it starts at its own, the sloughing off, its edge is elevated over there, and we see the blood vessels around it. This is probably the safe time to remove the bandage contact lens and the glue. Corneal epithelial defect will be there. It will take time to heal. But this is a very effective way to control the corneal perforations. Slit lamp section of the same eye, it can be seen that the anterior chamber has started forming after the application of the glue and bandage contact lens. Yes, whenever the glue is applied, area is cleaned. Before application, we can double check it by putting the fluorescein to make sure that in spite of applying the glue, there is no leakage. And very important to put minimal amount. Whenever we put large amounts of over there glue and we do not clean the area over there, that compromises wound healing process. This was my presentation today about the management of the micro level leaks 2 to 3 millimeter by the non-invasive way, by the use of cyanoacrylate glues. Very important, they are effective, they are non-invasive, they are bacteriostatic, they inhibit collagenase activity. So I doesn't go that much under corneal meltdown, but it still has got, as a foreign body, it can induce inflammation in the eye also. So regular follow-up of these patients is very important in the management. But otherwise, it is a very safe way, and it can be applied in OPDs, in the slit lamps, and if the surgeon is not comfortable, he can do it under microscope. So I hope my today's presentation will be beneficial for my dear audience. Thank you.